The body's morning alarms, recognizing early cancer. Warning signs. Have you ever woken up feeling inexplicably different, sensing that something within your body wasn't quite right? Perhaps it was a sudden and perplexing weight loss, an unfamiliar ache that seemed to materialize overnight, or the unsettling sensation of waking up drenched in sweat despite a comfortably cool room. These subtle yet significant changes, often dismissed as mere quirks or inconveniences, could potentially be your body's way of raising a red flag, signaling the early stages of a serious underlying condition, such as cancer. Far too often, individuals tend to overlook these seemingly minor signals, attributing them to the inevitable wear and tear of aging or the temporary effects of stress. However, neglecting these early warning signs could mean missing a crucial opportunity to detect a potentially life-threatening disease in its nascent stages, when treatment options are often more effective and the chances of successful remission are significantly higher. In this comprehensive guide, we will delve into 4 critical signs that, according to medical professionals, could indicate an elevated risk of developing cancer. Some of these signs may come as a surprise, while others might be symptoms that you've already noticed in yourself or a loved one. By the end of this exploration, you'll be equipped with the knowledge necessary to recognize these potential warning signs, understand their significance, and most importantly, know what steps to take next to safeguard your health. 1. Chronic cough or hoarseness, when a lingering irritation demands attention. A persistent cough or a noticeable change in your voice characterized by hoarseness that doesn't resolve over time can be a particularly concerning symptom, especially for older individuals. While temporary coughing is often triggered by common ailments such as colds, seasonal allergies, or minor respiratory infections, a cough that lingers for weeks or even months without improvement may indicate a more serious underlying issue, such as lung or throat cancer. This symptom is frequently associated with cancers affecting the lungs, throat, or larynx, voice box. For seniors, this symptom can be particularly challenging to identify, as it is sometimes mistakenly attributed to age-related respiratory issues or chronic conditions like bronchitis. However, if the cough persists despite conventional treatments and worsens over time, it could be a sign that a tumor is pressing against the airways, obstructing airflow, and triggering a persistent cough reflex. Furthermore, hoarseness in the voice can indicate that a tumor is affecting the vocal cords themselves, or the delicate network of nerves that control their function. The tumor's presence can disrupt the normal vibration of the vocal cords, leading to a raspy, strained, or weakened voice. Real-life example. Consider the case of George, a 72-year-old man who had been experiencing a dry, irritating cough and a persistent hoarseness in his voice for several months. Initially, he dismissed these symptoms as a lingering cold, assuming they would eventually subside on their own. However, as time passed, the symptoms not only failed to improve, but also gradually worsened. Concerned by the persistent nature of his symptoms, George eventually sought medical attention. An X-ray revealed the presence of a tumor in his lung, which was pressing against his vocal cords and airways. Unfortunately, the condition had progressed significantly by the time it was diagnosed, highlighting the importance of early detection and prompt medical evaluation. The link between a persistent cough and lung or throat cancer should not be taken lightly. If you experience a prolonged cough, difficulty breathing, or noticeable changes in your voice, especially if these symptoms persist for more than 3 weeks, it's crucial to seek medical attention immediately. Early detection can significantly improve the effectiveness of treatment and increase the chances of a positive outcome. Don't wait for the symptoms to worsen before taking action. 2. Persistent morning fatigue, unmasking the exhaustion that doesn't fade with rest. Waking up in the morning should ideally leave you feeling refreshed, rejuvenated, and ready to tackle the day ahead. At the very least, you should feel somewhat better than you did when you went to bed the night before. However, if you consistently find yourself waking up feeling just as exhausted, if not more so, than you did the previous night, it may not simply be a case of a bad night's sleep. Medical professionals caution that persistent morning fatigue, particularly when it occurs despite getting adequate rest, can be an early indicator of cancer. Cancer-related fatigue is distinct from ordinary tiredness or the temporary exhaustion experienced after a long day of work or physical exertion. It is an overwhelming and debilitating sense of exhaustion that doesn't improve with sleep, rest, or relaxation techniques. This type of fatigue often arises from the body's diversion of energy to combat a disease that is growing and spreading within the body. The cancer cells compete with healthy cells for vital nutrients, depriving the body of the energy it needs to function optimally. Blood cancers, such as leukemia and lymphoma, are particularly well known for causing extreme fatigue, often most noticeable in the morning when the body is supposed to feel recharged. These cancers affect the body's ability to produce healthy red blood cells, leading to anemia, a condition characterized by a deficiency of red blood cells, which are responsible for carrying oxygen throughout the body. Anemia can result in persistent exhaustion, weakness, and shortness of breath. However, it's not just blood cancers that can trigger persistent morning fatigue. Lung cancer, liver cancer, and colon cancer can also lead to systemic inflammation, which disrupts sleep cycles, impairs energy production, and causes deep, unrelenting fatigue that persists throughout the day, particularly in the morning. Many people tend to dismiss their morning tiredness as a normal part of aging, attributing it to decreased physical activity, changes in sleep patterns, or other age-related factors. However, when that fatigue lingers for weeks or months, accompanied by other concerning symptoms such as dizziness, loss of appetite, or unexplained weight changes, it becomes a red flag that warrants further investigation. Real-life example: consider the case of George, a 74-year-old man who cherished starting his day with a brisk morning walk. However, he began noticing that no matter how early he went to bed or how much sleep he got, he still woke up feeling drained and depleted of energy. At first, he attributed his fatigue to the natural aging process, assuming it was simply his body slowing down. However, as the weeks went on, the fatigue became progressively worse. Even simple tasks like making breakfast or doing light household chores felt exhausting and overwhelming. Concerned about the persistent nature of his fatigue, George eventually consulted his doctor. A thorough medical evaluation revealed that he had undiagnosed leukemia, which was severely affecting his energy levels and overall well-being. Because the condition was caught early, treatment was much more effective. and George was able to achieve remission and regain his energy and vitality. Today, he feels stronger and more energetic than he has in years, underscoring the importance of recognizing and addressing persistent morning fatigue. If you're waking up every morning feeling exhausted, even after a full night's sleep, it's crucial to pay attention to this symptom. Keep track of how long the fatigue lasts, note any other unusual symptoms that accompany it, and discuss your concerns with your doctor. Fatigue that doesn't go away with rest could be one of the earliest warning signs that something serious is happening beneath the surface, demanding prompt medical attention. 3. Unexplained morning sweats, deciphering the drenching signals of a potential threat. Waking up to find yourself covered in sweat might not seem particularly unusual at first. Many people assume it's simply a reaction to warm room temperatures, heavy blankets, or hormonal fluctuations. However, when night sweats happen repeatedly, soaking your sheets and pajamas, even when the room is comfortably cool, it could be a sign that something deeper is going on within your body. Medical professionals caution that persistent, unexplained morning sweats could indicate an underlying cancer, especially if they occur alongside other concerning symptoms such as weight loss, fatigue, or unexplained pain. Certain cancers, particularly lymphoma, leukemia, and some hormone-related cancers, can cause excessive sweating, particularly at night. This phenomenon occurs because cancer affects the body's immune response, triggering inflammation and temperature dysregulation. When the immune system is constantly activated in an attempt to fight off the cancer cells, it can lead to fevers and night sweats as the body tries to regulate its internal temperature. Here's what many people don't realize. These sweats often go unnoticed until they become severe and disruptive. Many people dismiss them as a minor inconvenience or attribute them to aging, stress, menopause, or other common factors. However, what sets cancer-related night sweats apart is their intensity and frequency. They're not just mild perspiration or occasional clamminess. They are drenching sweats that leave you soaked, forcing you to change your clothes or even your bedding multiple times a week. This level of sweating is far beyond what is typically experienced with normal hormonal fluctuations or mild illnesses. Real-life example. Consider the case of Richard, a 71-year-old retired teacher. He never thought much about his occasional night sweats, assuming they were just a normal part of aging. However, the sweats gradually became more frequent and intense, eventually happening every single night. He'd wake up feeling clammy and uncomfortable, sometimes needing to towel off before even getting out of bed. At first, he dismissed the sweats as a minor annoyance, attributing them to his age and the possibility of hormonal changes. However, when he also started losing weight and feeling unusually fatigued, he decided to visit his doctor to investigate the underlying cause of his symptoms. The medical tests revealed that he had lymphoma, a type of cancer that affects the lymphatic system. Catching the lymphoma early made a significant difference in his treatment and recovery, highlighting the importance of recognizing and addressing unexplained night sweats. If morning sweats are happening regularly and without a clear cause, especially if they're drenching your pajamas or sheets, it's not something to ignore. Take note of how often they happen, whether they're accompanied by other symptoms like weight loss or fatigue, and bring it up with your doctor. It could be your body's way of signaling that something is wrong long before other symptoms become apparent. 4. Unexplained weight loss, the morning revelation of a troubling transformation. Waking up and realizing your clothes feel looser than usual, or stepping on the scale only to see the numbers dropping without any conscious effort may seem like a minor change at first glance. However, medical professionals warn that unexplained weight loss, particularly when it's noticeable in the morning, can be one of the earliest and most concerning signs of cancer. The body naturally burns calories even during sleep, utilizing energy to maintain vital functions such as breathing, circulation, and cellular repair. However, when a person experiences rapid and unintended weight loss, it often indicates that the body is using energy in ways it shouldn't, such as fighting off a growing disease or dealing with metabolic imbalances caused by cancerous processes. One of the most common cancers linked to sudden weight loss is pancreatic cancer. The pancreas plays a key role in digestion, producing enzymes that help break down food and absorb nutrients. When the pancreas is compromised by cancer, its ability to perform these functions is impaired, leading to malabsorption, digestive problems, and ultimately, weight loss. Similarly, gastrointestinal cancers such as stomach or colon cancer can interfere with how the body processes food, causing dramatic changes in metabolism and nutrient absorption. These cancers can also lead to a decrease in appetite, nausea, vomiting, and other digestive symptoms that contribute to weight loss. However, it's not just digestive-related cancers that cause weight loss. Lung cancer, lymphoma, and even advanced prostate cancer can trigger the release of inflammatory compounds called cytokines, which speed up metabolism and break down fat and muscle tissue. This phenomenon, known as cachexia, is characterized by severe weight loss, muscle wasting, and a general decline in physical health. If you notice that your weight is dropping by more than 5% over a few weeks or months without any changes in your diet or exercise routine, it's time to take action. For example, if you typically weigh 150 pounds and you lose 7.5 pounds or more without trying, that's a significant amount of weight loss that warrants medical attention. Many people assume that weight loss is simply a part of aging, attributing it to decreased muscle mass, changes in metabolism, or decreased appetite. However, doctors emphasize that sudden, unintentional weight loss, especially when noticed in the morning before you've eaten, should never be ignored. Real-life example. Consider the case of Richard, a 72-year-old retiree who had always maintained a steady weight throughout his adult life. One morning, he noticed that his belt felt looser than usual. At first, he brushed it off, assuming it was just a normal fluctuation or a temporary result of water loss. However, over the next month, he lost nearly 15 pounds without changing his eating habits or increasing his physical activity. Concerned about the unexplained weight loss, Richard consulted his doctor, who ordered a series of tests to determine the underlying cause. The tests revealed that he had early-stage stomach cancer. Because he caught it early, his treatment options were much better, and he was able to undergo surgery and chemotherapy to successfully eradicate the cancer. Today, he's doing well and living a full and active life. His story is a powerful reminder that these small morning changes can be the key to catching something serious in time. If you've recently lost weight without trying, especially if it's noticeable in the morning before you've eaten, take note of it. Keep a record of your weight, monitor any other accompanying symptoms, and discuss your concerns with your doctor. Early detection and intervention can make all the difference in the outcome of cancer treatment. Final thoughts, key takeaways, and next steps. To summarize, the 4 signs in the morning that could indicate a serious health concern, especially cancer, are unexplained weight loss, persistent, unexplained morning sweats, chronic cough or a hoarseness, persistent morning fatigue that doesn't improve with rest. These are not symptoms to ignore, and if they persist or worsen over time, it's critical to seek medical advice promptly. Early detection is key to improving outcomes for many cancers, so being proactive about any changes in your health can make a huge difference in the long run. While it's important to remember that these signs don't necessarily mean you have cancer, they can also be caused by other medical conditions. They can be red flags that require a thorough medical evaluation. Our bodies often give us signals when something is wrong, and listening to them can help catch diseases before they become too serious. For older adults, maintaining regular health checkups, staying aware of potential symptoms, and promptly reporting any unusual changes to their healthcare provider can play a crucial role in preventing or managing potential health issues. Taking care of your health isn't just about avoiding sickness. It's about being informed, proactive, and making the right choices for your well-being. If you're concerned about any of the symptoms we discussed today, make sure to schedule an appointment with your healthcare provider. They can guide you on the next steps and help you get the proper diagnosis and treatment if necessary. Remember, your health is worth investing in. Don't wait for things to get worse before seeking medical attention. By being aware of these early warning signs and taking prompt action, you can empower yourself to protect your health and well-being. We'd love to hear from you. What's one thing you've learned from this discussion, and how do you plan to use it in your life? Your thoughts are important, so don't hesitate to share them. If you found this discussion helpful, please like, subscribe, and share. Your support helps us continue creating content that informs and inspires. Thanks for reading, and we look forward to connecting with you in the next video.